Right now, AI is already making diagnoses, reading scans, and recommending treatments. And the uncomfortable truth? In many cases already it's outperforming experienced physicians. So what happens to your clinical judgment and professional identity when the machine consistently proves itself right? I'm Dr. Paul, and today we're diving into the most important question facing modern medicine. Is AI a revolution that will transform patient care for the better? Or a risk that could fundamentally redefine the medical profession? You've heard the hype, you've heard the fears. But what's actually happening today, in clinics and hospitals just like yours? In the next minutes I'll reveal what AI can really do, what it definitively can't, and why understanding this shift now is critical, before your practice feels the impact. Stick around, because by the end, you'll know exactly where AI stands in medicine, and where you need to stand to thrive alongside it.
Artificial intelligence, or AI, is a way to train computers to recognize patterns, learn from experience, and make predictions, similar to how we as physicians develop insight after seeing hundreds of cases over time. Think of AI as a very fast learner. It looks at huge amounts of information, spots patterns that we might miss, and then applies that knowledge to new situations. AI doesn't think, feel, or understand the way we do. It follows patterns in data. It's not a human brain, but a tool designed to assist us. Now that we know what AI is, let's explore how it actually works in medicine.
Now let's see how AI works in medicine. First, AI learns from examples. It's like a student who studies thousands of medical records. The more X-rays it sees, the better it gets at spotting fractures. Second, AI finds patterns. It connects dots across many cases. It might notice things that even experienced doctors sometimes miss. Third, AI makes predictions. When you show it a new patient's scan, it compares it to everything it has seen before. Then it tells you what it found.
There are three types of AI you'll mainly see in your practice. First is rule-based AI. It's like a smart checklist. If this, then that. It helps with simple decisions but can't handle complex cases. Next is machine learning. This is what reads scans and spots patterns. It gets better with more data, and is what most medical AI tools use today. Last is generative AI, like ChatGPT. It creates things, patient summaries, notes, or even treatment plans. It's newer in medicine but growing fast. Knowing these types helps you understand what AI can and can't do in your practice. Now let's see real examples of AI already working in clinics, medical practices, and hospitals today. We've covered the basics. Now, for the part that will actually change your daily practice. In our next episode, we'll show you real cases where AI is already outperforming human physicians. Not in labs. In actual hospitals with real patients. Imagine an AI system that flags sepsis hours before clinical signs appear. Or another one that caught melanomas 3 board-certified dermatologists missed. Clinics are using AI to slash documentation time by 40% and streamline patient scheduling without adding staff. This isn't theoretical anymore. It's happening in clinics right now. Now hit subscribe. Because medicine is changing with or without you. See you next time.